Hi, I'm Dr. Jocelyn. Today is our special topic, and listen to my words carefully because what I'm about to share can truly change the way you think about your health, confidence, and intimacy. Many men over 40 or 50 think certain changes in their body are inevitable, that slowing down is normal, or that passion just fades with age. I'm here to tell you that is not the full story. You can feel vibrant, connected, and confident again, and it often starts with small, simple adjustments most men never hear about. Before we get into the details, I want you to take a moment to think about where you are right now. Maybe you've noticed a subtle drop in energy, or perhaps your intimate life isn't what it used to be. Maybe you feel a little embarrassed talking about these things, and that's completely normal. Many men avoid these conversations, even with their doctors or partners. But the truth is, ignoring them only makes the problem bigger. You don't need to accept decline as the only option. There's a lot you can do starting today. Let's start with one of the biggest myths about aging and intimacy, that it's all about age. It's not. Age can play a role, sure, but most challenges in the bedroom are tied to daily habits, mindset, and understanding your body, not a ticking clock. Men often struggle because they think their bodies are betraying them or that they've simply lost what they once had. That's not true. Real change comes from knowledge, awareness, and practical steps that reconnect you with your partner and yourself. One of the most common issues men ask about is the way the body communicates readiness and connection. This is something many avoid talking about because it feels taboo, but understanding it is key to building trust, confidence, and performance. Every body is different, and the natural changes that happen as we age do not mean failure. They are signals. Paying attention to them, learning what's normal, and approaching intimacy with curiosity instead of shame is transformative. Here's an example most men never think about: the natural fluids of your partner's body. Many men have been conditioned to think of these fluids as embarrassing or unclean. That belief is harmful, not just biologically, but emotionally. When a man rejects or judges these natural signals, it can create shame in a woman and damage the trust and safety that intimacy requires. On the other hand, when you see them as a sign that connection is safe and possible, it changes everything. Acceptance and understanding are more powerful than any mechanical skill or temporary fix. Another point to remember is that taste and smell vary naturally. Factors like diet, hydration, hormones, and age all influence how the body feels and smells. This is completely normal. Sudden changes accompanied by discomfort should be checked by a doctor, but everyday variation is nothing to fear. Acceptance and open communication are far more attractive than criticism or embarrassment. When you approach intimacy with respect, curiosity, and care, you lay the groundwork for a stronger, deeper connection. Even small shifts in perspective like this, replacing judgment with acceptance, understanding your partner's body, and noticing what's normal versus unusual, can reignite passion and trust. Many men over 50 think intimacy fades naturally, but the truth is, the strongest foundation for lasting connection is emotional safety, respect, and knowledge about your own body and your partner's. Now that we've set the stage, let's get into the habits that can make or break intimacy as you age. Many men over 40 or 50 make the same mistakes without even realizing it, and these mistakes can quietly erode trust, passion, and confidence. I want you to listen carefully because understanding these patterns will give you control back over your health and your relationships. Mistake number 5 is thinking your partner's natural fluids are dirty or something to avoid. This is one of the biggest misconceptions I see in my clinic. These fluids aren't random or messy. They're carefully designed by the body to protect, balance, and enhance connection. Biologically, they come from multiple sources: glands that reduce friction, the cervix producing mucus to maintain a healthy environment, and tissues that secrete enzymes and minerals that protect against infection. When men judge or reject these fluids, it can create shame and discomfort for their partners. Emotionally, this erodes trust and makes intimacy feel risky or awkward. But here's the shift: if you see these fluids as a natural signal that your partner's body is ready to connect, everything changes. Acceptance communicates safety, and that's far more powerful than any technique or supplement. Mistake number 4 is ignoring taste and smell. Many men are hesitant to talk about this, but it's natural to notice variations. Fluids can change depending on diet, hydration, stress, hormones, and age. Eating pineapple or citrus might give a lighter, fresher taste, while garlic, onions, alcohol, or coffee can make it stronger. Hormonal cycles also influence smell and taste, and after menopause, changes are normal. The emotional takeaway here is that variation is perfectly normal. No two people smell or taste the same at any given moment, just like no two men sweat the same after a workout. The practical mistake is turning this variation into criticism. Gentlemen, curiosity and acceptance are far more attractive and effective than judgment. Mistake number 3 is overlooking safety. Many men worry about whether it's safe to engage in oral intimacy. For healthy monogamous couples, the risk is very low. Fluids are mostly water, enzymes, and protective compounds. Biologically, they are actually less risky than everyday activities like kissing or sharing drinks. But we need to be realistic. Sexually transmitted infections exist, and the risk rises if one partner has an active infection, mouth sores, or bleeding gums. The key here is honesty. Talk openly, get tested together, and use protection when necessary, especially with new partners. True intimacy doesn't ignore safety, it embraces it. Safety and trust go hand in hand, and when couples communicate openly about risks and boundaries, their connection deepens. Assuming no symptoms equals no risk is a common trap, and one that can harm both trust and health. Mistake number 2 is staying silent out of embarrassment. I cannot stress this enough. Men often avoid conversations about changes in smell, taste, or interest in new forms of intimacy, thinking it's awkward or shameful. Silence doesn't protect the relationship, it weakens it. Small, unspoken issues grow into tension and distance. Biologically, the body is always changing. After menopause, illness, or dietary shifts, fluids change too. Emotionally, hiding concerns makes your partner feel rejected without explanation. The practical solution is simple. Communicate kindly out of curiosity, not criticism. Ask questions, share thoughts, and treat it as a team effort. When couples do this, intimacy becomes more playful, less stressful, and far more satisfying. Now we're getting to the most important point, the one that changes everything. Mistake number 1 that men make is forgetting the emotional power of acceptance. This is where many relationships struggle, even when everything else seems fine. When a man truly embraces his partner fully, including all the natural changes her body goes through, he communicates something powerful. I accept you completely. I trust you. I love every part of you. Biologically, this acceptance allows her to relax. Relaxation increases natural lubrication, enhances arousal, and makes intimacy far more enjoyable for both partners. Emotionally, it heals years of quiet shame that many women carry about their bodies, their fluids, or the way they feel during intimacy. Practically, this creates space for playfulness, trust, and freedom, and it completely changes the energy in the bedroom. The biggest mistake men make is thinking intimacy is just mechanics, techniques, pills, or quick fixes. In reality, the strongest performance enhancer isn't something you can buy. It's the feeling your partner has when she knows she is fully accepted. That kind of acceptance builds confidence, connection, and passion in ways that nothing else can. So how do you apply this today? It starts with small, intentional actions. First, have the health conversation. Suggest testing together. This isn't about mistrust, it's about partnership. Making it a regular habit, twice a year for example, keeps both partners informed and safe. Knowledge reduces worry, and worry is one of the biggest energy killers in intimacy. Next, pay attention without judgment. Notice changes in taste, smell, or consistency. If something feels off, don't criticize. It's usually normal variation, but sometimes it's a small imbalance that can be treated easily. Approach it as a team. Take a shower together, encourage hydration, or gently support her in checking with her doctor. These small acts communicate care and reinforce connection, turning what could be awkward into shared intimacy. Finally, practice acceptance. Remind yourself that her individuality is not a flaw. Her body's natural responses are not a problem. They are signals of readiness, trust, and health. Shifting your mindset from judgment to curiosity changes not only your partner's experience, but yours as well. When men do this consistently, relationships feel lighter, safer, and more exciting. It's normal to feel shy or hesitant at first. Many men do. But remember, you are not alone. These concerns are common, and every couple faces them in one way or another. The difference is who talks about it openly and kindly. Those who do find their intimacy not just survives, but thrives. By focusing on acceptance, safety, and communication, you're taking steps that support both your physical and emotional health. These aren't gimmicks or shortcuts. They are foundational habits that make passion, pleasure, and trust grow stronger every day. And the good news is, it's never too late to start. When you embrace these principles, you start to realize that passion doesn't have an expiration date. Your 50s, 60s, even 70s can be some of the most connected, confident, and fulfilling years of your life. It starts with understanding, care, and small, intentional choices that build trust and closeness over time. Now let's wrap it up with practical steps you can use every day. Small actions create lasting change, and they start with communication. Talk openly with your partner about your health, changes you notice, and curiosity you have. Approach it as a team, not a criticism session. Suggest testing together, not as a question of trust, but as a way to protect and care for each other. Twice a year is a healthy standard, and it removes worry from the equation. Next, pay attention without judgment. Notice variations in taste, smell, or energy, but treat them as normal. If something feels off, a gentle shower, extra hydration, or a check in with a doctor can handle most issues. Avoid criticism. Acceptance and curiosity are far more powerful than judgment. These simple acts communicate care, respect, and safety, creating a space where intimacy can thrive. Finally, practice full acceptance. Embrace your partner's individuality and the natural changes her body experiences. Her fluids are not dirty. They are signs of health, readiness, and trust. By accepting her completely, you allow both of you to relax, enjoy, and connect on a deeper level. This acceptance is the strongest performance enhancer you'll ever find, far more effective than pills, gimmicks, or techniques. Remember, passion doesn't retire. Your 50s, 60s, 70s, and even 80s can be your most connected, confident years. Safety, trust, and acceptance are the foundation for lasting intimacy. Care for your health, communicate openly, and embrace connection fully. When you do, intimacy doesn't just survive, it thrives. Take this advice, apply it today, and watch small changes bring comfort, freedom, and confidence back into your life. Passion does not expire, and neither should you.